Has your doctor diagnosed you with major depression disorder, or do you have depression as a result of your bipolar personality disorder? Has your depression not responded to other medications? Talk to your doctor about phenelzine, otherwise known as Nardil, a medication that belongs to the MAOI class of antidepressants, monoamine oxidase inhibitors. This medication can be used to treat depression that has not responded to other classes of antidepressants, as well as depression in bipolar personality disorder. Sometimes MAOIs can be used to treat other conditions such as Parkinson's disease. It can be taken orally between 1 and 3 times a day and with or without food. So how does it work? An enzyme called monoamine oxidase is involved in removing the neurotransmitters norepinephrine, serotonin, and dopamine from the brain. MAOIs prevent this from happening, which makes more of these brain chemicals available to affect changes in both cells and circuits that have been impacted by depression. MAOIs also affect other neurotransmitters in the brain and digestive system, causing some side effects. Some of these side effects include orthostatic hypotension, anxiety, insomnia, agitation, hypertensive crisis in the presence of tyramine-containing food, constipation, nausea, vomiting, and other GI symptoms, as well as suicidal ideation, especially in children. So how can you avoid these side effects? Rise slowly from lying or sitting positions and lie down if you're lightheaded. Report extreme anxiety, insomnia, and agitation to the provider. Notify provider if GI issues occur. Do not eat any foods that may contain tyramine, and if GI symptoms occur, take the medication with non-tyramine containing foods. Some of these foods containing tyramine include the following: cheese, bananas, aged processed and smoked meat, fish, soybeans, tofu, nuts, soy sauce, yeast, beer, and red wine. Notify your provider immediately if you ingest any of these food products. When taking phenelzine, do not intake chocolate or caffeine as it can cause hypertension. Do not take with antihypertensive medications as this interaction may cause hypotension. Do not take with meperidine as this can cause a fever. Do not take if you also take SSRIs or have an alcohol or drug addiction. Do not take this medication if you have an allergy to MAOIs, if you are unable to adhere to a tyramine-free diet, if you experience suicidal ideation, have renal failure, liver disorders, cardiac disease, or glaucoma. Do not take if you are over the age of 60 or less than 6 years old. Tell your doctor if you have epilepsy, diabetes mellitus, or experience schizophrenia or mania. Talk to your doctor today about what your new life could look like on phenelzine.